Okay, hello. Today we're going to go over the COVID-19 abstraction guidance. This slide just tells you a little bit about me and where I come from. I'm Peggy Adamo, and I am with the NCI Seer program. Today we will cover the COVID-19 abstraction guidelines. We'll go over the reason for abstraction. We'll talk about where to find the guidelines on the website. We'll talk about the data that we're asking you to abstract. We'll go over the text fields that we're going to be using for this process, the cases to be abstracted, and we'll have field-by-field instruction. So first of all, let's talk about the reason for abstraction. The main reason is that we are looking for information about the effect of the pandemic on cancer diagnoses and cancer patient outcomes. We are hearing that in some cases, new cancer cases are not being identified or the identification is being delayed due to the pandemic. We want to be able to quantify the effect of that on our incidence rates and our other cancer statistics, be able to understand patients that are being diagnosed at a later stage, or perhaps incidence rates are being delayed. Also, we want to understand cancer patient outcomes, the effect of treatment delays on those outcomes. We may need to explain why we're seeing poor survival, perhaps. That's one example. This is just a screenshot of where you can find the abstracting instructions posted on the Seer website, and this presentation should be posted nearby as well. So what data are we asking you to abstract? We are asking you to abstract information about SARS-CoV laboratory tests, also information about the infection status of the patient, and lastly, delays or modifications of treatment for any cancer patient, not just the patients that are tested for COVID-19 or diagnosed with COVID-19. The delays for treatment, we're looking for information about that affecting any cancer patient that you may be abstracting. These are the text fields that we'll be using. There are 8 text fields that are identified for collecting this information. One text field is for lab tests. One is the remarks field, and there are 6 treatment text fields that we'll be using. And you're probably wondering, why did we choose to collect this information in text fields? Mostly because they already exist. We did not have to create new data items to get this going, and we wanted to get it going quickly. These text fields are already in your software, so they're available for use right away, and they can be quickly employed for data collection, which was the main goal here, was to get this going really fast. Creating new data items takes quite a bit of time, so we didn't go that route. We went with the text fields for the ability to get the information abstracted quickly. NCI Seer will be developing natural language processing tools to extract the information from the text fields, and that's why we have these specific instructions about how to record the text information so that we can obtain this information later through NLP. What cases are we asking you to abstract? Please begin as of cases you're abstracting June 1, 2020 or later. The cancer diagnosis should occur January 1st, 2020 or later, unless you have instructions from your central registry that differ. Some central registries may go back farther or start sooner, but you'd know that by now. You would have received those instructions from your central registry by now. If you did not receive any information different, follow these instructions. There's no expectation from Seer that you'll go back and record this information for cases that you've already abstracted. So just begin right away with the cases you're currently abstracting. I've used screenshots throughout the rest of this presentation from our abstracting tool called Seer ABS, just to give you a visual of the text fields. This is how they look in the Seer ABS application. This is an example of the lab test text field, and that's the first one we're going to talk about. In the lab test text field, we want you to record the interpretation of the SARS-CoV-2 viral testing and antibody testing, and we also want you to record the date of the SARS-CoV viral testing and antibody testing. We'd like you to record separately the viral nucleic acid testing from the antibody testing. We'd like you to always record the interpretation and the date of the latest or most recent positive antibody testing. Do not record tests that have an unknown test type. If you don't know if it's a viral nucleic acid test versus an antibody test, please don't record it. And do not record tests with no interpretation or when the interpretation is unknown. You can record a partial date when the interpretation of the test is available, but the date is not fully known. For example, you could record only month and year if that's all you have, or just the year if that's all you have. And please do not approximate the date if it's unknown. Just record what you know. Code presumptive positive COVID-19 test results as confirmed. When there are multiple tests with multiple interpretations available, we'd like you to record the date of the first positive test when there are multiple interpretations available for multiple viral nucleic acid tests. Record the interpretation and the date of the last negative test when there are no positive tests available, but one or more multiple negative SARS-CoV-2 viral nucleic acid tests are documented. And on the screen right now, you can see examples of how we want this information recorded in the text field. The first one is COVID-19 viral positive test, and that's the date, an example of how the date would be recorded. The second example is a COVID-19 viral negative test with the date, and an antibody positive test and the date of that. So those are some examples of what we're asking you to record in the lab test text field. This is an example of what the remarks text field looks like in Seer ABS, and we'll talk about that now. In the remarks text field, we'd like you to record information about the diagnosis of COVID using the ICD-10 diagnostic code and the date. And we'd also like you to record information about general cancer treatment delays or modifications. So let's talk about recording the ICD-10 diagnosis code first. We want you to record that code when there is a confirmed diagnosis of the 2019 novel coronavirus disease, the COVID-19, as documented by the medical provider. Record the code, which is U07.1, for a confirmed diagnosis of COVID-19. And by confirmed, it doesn't require documentation of the type of test performed, but the provider's documentation that the individual has COVID-19 is sufficient. When that is documented in the medical record, you can record the code U07.1 in the text field. In addition, record U07.1 when the code was used for diagnosis within the facility electronic health record, or within the hospital discharge, or you've seen it in the record as a contributing or underlying cause of death. Record U07.1 for a lab-confirmed asymptomatic patient, but do not record U07.1 when the provider documents suspected, possible, probable, inconclusive, or any wording of a suspicion of COVID-19. That's where we go back to saying we want the confirmed diagnoses only. And registrars are not required to record codes for the acute respiratory illnesses that are associated with COVID-19, for example, pneumonia. Neither are you required to record exposure to COVID or screening for COVID. Signs and symptoms, don't record those. only record the definitive diagnosis of COVID in this field. And then we want you to record the date of that confirmed diagnosis. If you have the test date, that would be the best date to record here. You could also record an office visit date if that's the best date available. If you don't have good date information, you could record the hospital admission date. And as a last resort, you could record the hospital discharge date. Here on the screen is an example of what that documentation will look like in the text field. Down here, U07.1 and then the date, the best date that you can come up with. So next, let's talk about the general cancer treatment delay information that we want recorded in this field. Of course, it's always preferable to abstract information about treatment in the treatment text field. However, information about specific treatment modalities may not be available, and the only information available is about treatment in general, with no mention of a specific procedure. So when that happens, we want you to use this remarks field. So when the first course of treatment was modified because of COVID-19 and no other specific details are provided in the treatment text fields, record first course of treatment changed due to COVID-19, FCOT changed due to COVID-19. That means the first course of treatment was changed due to COVID-19. When the diagnosis, staging, treatment, any modality, or other cancer management events have been delayed because of limited access to facilities or postponement of non-essential procedures due to COVID-19, abstract the date of the decision to postpone and use this Z75.3 code. Z75.3 means unavailability or inaccessibility of healthcare facilities. So you're recording that plus the date of that decision. The abstractor can use both of these, the FCOT and the Z code, at the same time. This combination is required when multiple steps of cancer management, diagnosis, staging, or treatment modalities were affected by unavailability or inaccessibility of oncology care. No recording is necessary when the first course of treatment was not delayed, rescheduled, or otherwise modified because of the COVID pandemic. Moving on to our first treatment-specific text field, this is the surgery field. We are asking you to record information in this text field about surgery delays or modifications due to COVID-19. Typical surgery recommended might have been performed but delayed due to COVID-19. In that instance, we want you to use this text documentation, surgery treatment delayed due to COVID-19. Surgical treatment might have been recommended before but administered after disease progression. In that situation, we want you to record surgical treatment delayed due to COVID-19 and given as subsequent treatment after progression. If your facility collects subsequent treatment fields, you can record this information in the subsequent treatment fields. If you don't collect those fields, don't worry about it. Just this documentation in the text surgery data item is sufficient. If the type of surgery offered and performed was changed or modified due to COVID-19 from what it typically was, you would record surgical treatment changed due to COVID-19. If it's delayed and changed, you would record surgical treatment delayed and changed due to COVID-19. And lastly, if the surgical treatment was canceled due to COVID-19, it was not performed at all, you would record surgical treatment discontinued, DC, due to COVID-19. Next, we'll talk about the text field for recording information about beam radiation, and you'll begin to see a pattern here that will make things a little bit easier as we move along. In the text field for beam radiation, we'd like you to record information about beam radiation delays, discontinuation, or modifications due to the COVID-19 pandemic. So when there's medical documentation available indicating that beam radiation was discontinued or the plan was changed because of the pandemic, record external beam radiation therapy, EBRT, discontinued due to COVID-19. And in place of EBRT in any of these examples, you could substitute XRT or RT as appropriate for your individual situation that you're abstracting. When medical documentation is available to indicate that the initiation of beam radiation planning or administration was delayed due to the pandemic, record EBRT delayed due to COVID-19. When beam radiation was recommended before but administered after the disease progression, record EBRT delayed due to COVID-19 and given a subsequent treatment after progression. And the example up here that I didn't cover is when it's changed, EBRT changed due to COVID-19. Next, we'll talk about the text field for recording information about radiation other than beam therapy. In this field, we want you to record information about radiation delays, discontinuation, or modifications due to the pandemic. When there's documentation available indicating that brachytherapy, systemic therapy, or any type of radiation other than beam was discontinued or the plan was changed because of the pandemic, record RT discontinued due to COVID-19 or RT changed due to COVID-19. You could also use ICB for intracavitary brachytherapy, discontinued or changed due to COVID-19. When there's documentation available indicating that the initiation of brachytherapy or systemic therapy or any type of radiation other than beam, that it was delayed because of the pandemic, you can record RT delayed due to COVID-19 or ICP delayed due to COVID-19. When any of these types of radiotherapy other than beam was recommended before but was given after disease progression, you can record RT delayed due to COVID-19 and given a subsequent treatment after progression, or if it's intracavitary brachytherapy, you can record ICB delayed due to COVID-19 and given a subsequent treatment after progression. Next, we'll talk about the text field for chemotherapy. And in this field, we want you to record information about chemotherapy delays, discontinuation, or modifications due to COVID-19. When there's documentation indicating that chemotherapy was discontinued or not initiated because of the pandemic, record chemo discontinued due to COVID-19. When medical documentation is available indicating that the chemotherapy regimen was changed due to the pandemic, in other words, examples might be infusion was changed to oral or there was a reduction in the number of cycles, we want you to record chemo changed due to COVID-19, chemo changed due to COVID-19. When the documentation in the record indicates that the chemotherapy was delayed due to the COVID-19 pandemic, record chemo delayed due to COVID-19. And as you've been hearing in the other treatment text fields, when chemotherapy was recommended before but administered after disease progression, record chemo delayed due to COVID-19 and given a subsequent treatment after progression. Next, we'll talk about the hormone therapy text field. In this text field, we'd like you to record information about hormone therapy delays, discontinuation, or modifications due to COVID-19. When there's documentation indicating that hormone administration was discontinued or not initiated because of the pandemic, record hormone discontinued due to COVID-19. When the medical documentation indicates that hormone was was changed. I'm sorry, that the hormone prescription was changed because of the COVID-19 pandemic. Record hormone change due to COVID-19. When the medical documentation indicates that initiation of hormone therapy was delayed because of the pandemic, record hormone delayed due to COVID-19. And again, as we've seen before, when hormone therapy was recommended before but was administered after disease progression due to the pandemic, record hormone delayed due to COVID-19 and given as subsequent treatment after progression. Next, we'll look at the text field for biologic response modifiers or immunotherapy. And in this text field, we would like you to record information about BRM or immunotherapy delays, discontinuation, or modifications due to COVID-19. You should be getting the hang of this. You should be seeing the pattern emerging pretty clearly here. When there's documentation available indicating that immunotherapy or bone marrow or stem cell transplant administration was discontinued or not initiated because of the pandemic, record BRM discontinued due to COVID-19 or BMT for bone marrow transplant discontinued due to COVID-19. So this text field pertains to anything that would be reported in the BRM data item. So that's why we're talking about bone marrow and stem cell transplant. When there's medical documentation indicating that immunotherapy administration was changed due to the pandemic, record BRM change due to COVID-19. When there's information available indicating that the initiation of the BRM or the immunotherapy was delayed because of the pandemic, record BRM delayed due to COVID-19, or you might record BMT if you're talking about a bone marrow transplant, delayed due to COVID-19. And for the situation where immunotherapy was recommended before but administered after disease progression, record BRM delayed due to COVID-19 and given as subsequent treatment after progression. So we made it through all of the text fields that we'd like you to use to record the COVID information. And again, recording information about treatment, delays or changes or modifications pertains to any cancer patient, not just the patients that are tested for COVID or have a positive result. If you have questions about these instructions, please submit them to Ask a Seer Registrar, and the link to that is shown on your screen. That is the preferred method for submitting questions. We are able to track them much better when they're submitted to Ask a Seer Registrar and use them to provide additional education and improve our instructions. You may also submit them directly to me, and that is my email address. We will take some of the questions that we receive either way through Ask a Seer Registrar or the ones sent directly to me and add them to the Seer inquiry system and make them available for others to reference. And we're also going to post some question and answers that we're receiving. We'll post it on the website along with these instructions and presentations for people to reference. So with that, I'll say thank you very much. We really appreciate your efforts to collect this information. It's very important for our cancer patients and very important for the cancer statistics that inform treatment decisions and other important information down the line. So I'll thank you and say keep calm and text on. Thank you.